up, guys? Dr. Anthony Lytle here. I'm with Frank Fazzosi again. Welcome back to our podcast. What we wanted to discuss today was hormone therapy for men. Frank was kind of excited about it because I think he likes doing it. So,
yeah.
What we can talk about, I can give an introduction on what hormone replacement therapy is for guys, kind of what it entails. And then I think we can kind of talk about some of the benefits and some of the experience that both Frank and I have in doing it. So let me give you a little bit of an overview on what hormone therapy is like for men. So essentially, hormone therapy revolves around testosterone with men. Testosterone is naturally going to be higher in men. Men also do have estrogen. They make their estrogen from testosterone. And it's healthy for men to have adequate levels of estrogen. Estrogen actually helps with libido, but it also helps with heart health, and it can help with the elasticity and the flexibility of the blood vessels. Estrogen is also a growth hormone, so it can actually help to increase angiogenesis, which is the creation of blood vessels. So those are all good things if it's within normal levels. That's all healthy for men to have good heart health, flexible blood vessels.
Keep it rocking in the bedroom.
Keep it rocking in the bedroom. That's more a little bit on the testosterone side. But estrogen does help. I've had some men where they talk about having very low levels of estrogen and their libido actually takes a hit because of that. So I think for men, the two main sex hormones being the testosterone and estradiol. When I measure estrogen on labs, it's usually estradiol for men. There's a couple different kinds of estrogens. There's estriol and there's estrone, but it's usually estradiol that has the majority of the effects in the body for men and women. So aside from those two, there are other growth hormones and sex hormones that come into play. So progesterone's another one. Progesterone with men, a lot of times it has similar functions as testosterone, but it can also help with sleep in both men and women. And progesterone, I don't normally prescribe it for every man, but there could be certain instances where they might need it, especially for sleep. There may be some other applications beside that in men, but a lot of times you'll see it used in women more often for night sweats, and also to replace progesterone that women are no longer making due to menopause. You don't necessarily see that same need in men to the same extent. Other hormones that I would typically deal with, oxytocin might be another one. Oxytocin is released, especially in women, upon like childbirth. It's the kind of like a cuddle hormone. If potentially you have trouble in the bedroom where the intimacy and the closeness is not there, you can actually inject oxytocin, or you could take, I think it's given orally as well, but oxytocin could also be used for intimacy and those purposes. There's also DHEA. So DHEA is a sex hormone that is released by the adrenal glands, and it's the most abundant sex hormone in the body, even more so than testosterone and estrogen. And DHEA, I like to think of it this way, that it helps with stress resiliency because it can counteract the effects of cortisol, but it can also help with some muscle building. In men, it doesn't increase testosterone levels, at least on the labs that I've seen or in the research that I've seen. Actually, in women, it will increase total testosterone, which is kind of interesting.
You put me on that not too long ago, and I felt a difference from it. You said I feel more rested when I wake up, and I do. So
yeah,
it made a big difference.
And I think that has to do with the counteracting of cortisol.
Yeah. Mm-hmm.
And younger people tend to have higher levels of DHEA and testosterone. Those levels tend to decrease around 30. So kind of adding back in the DHEA in high levels, typically, maybe optimally speaking, greater than 400 on labs or around 400 for DHEA, that's going to help you to feel kind of younger when you wake up in the morning. That's maybe the best way I can describe it.
It does make a difference, for sure.
At least with your endurance and your energy throughout the day. Those are some of the main ones. We can kind of talk about thyroid a little bit too. But thyroid isn't one of the main sex hormones that I typically consider. A lot of men don't have the same issues or autoimmune issues with with thyroid, having a low thyroid, that women will tend to have. Women are more likely to have autoimmune diseases, and they're more likely to have autoimmune thyroiditis. In men, the majority of men that I see, they typically have pretty good thyroid function. I don't really have to dig into it too much with most guys. Maybe you'll get like a more heavyset guy that has a slower metabolism and they might need a little bit of help with thyroid hormone, but that's not always the case. So it's really based on the patient and the individual. So this was kind of like our introduction. In the next video, we're going to talk about maybe some of the effects that you might see and some personal experiences. So stay tuned on the next one. Like and subscribe this channel so that YouTube takes this content further outside of our network, and so that more people can get this very powerful information. So we'll see you on the next one.
All right, next.